Myocardial infarction, also known as a heart attack, is a serious medical emergency that occurs when the blood supply to part of the heart muscle is suddenly blocked. As a result, the heart does not receive a sufficient amount of oxygen, and with the passing of the minutes it undergoes necrosis, that is, the death of the cells of the cardiac muscle tissue. A myocardial infarction can cause cardiac arrest, which is a sudden interruption of the heart's electrical activity that causes loss of consciousness and cessation of breathing. If not treated immediately, it leads to the death of the patient within minutes. Remember that cardiovascular diseases, including myocardial infarction, are the leading cause of death worldwide, responsible for nearly 18 million deaths each year. This is a staggering number that accounts for 31% of all deaths globally. In the last video, which you can find by clicking above, we saw the early signs and symptoms of a stroke. In this video, however, we will go to see the warning symptoms of a myocardial infarction. Chest pain. One of the characteristic symptoms of myocardial infarction is very intense chest pain that appears suddenly. It can be of the constricting type, like a vice that tightens the heart ever more strongly, or of the oppressive type, that is, like a weight that crushes the chest. The cause of chest pain is a direct result of the heart muscle cells not getting enough blood, and therefore oxygen, to function properly. In the case of a heart attack, the pain usually lasts longer than 15 minutes and persists even if you are at rest, and can also be accompanied by sweating and vomiting. However, remember that chest pain, although it is a typical symptom of myocardial infarction, in some cases may not appear or may be mild. We speak of a silent heart attack, and it manifests itself with less common symptoms, such as heartburn and a general state of malaise, reminiscent of what we feel during a simple flu. It especially affects those who already have diabetes and those with medical conditions that prevent the nerves from transmitting pain correctly. Arms pain. In the case of a myocardial infarction, chest pain can extend to the arms, but also to the jaw, neck, back, and abdomen. Usually the pain occurs in the left arm because it is closest to the heart, but it can also radiate down the right arm. Arm pain is due to the fact that the nerves branching off from the heart muscle and those coming from the arm send signals to the same brain cells, thus preventing the brain from accurately identifying the exact origin of the painful sensation. This phenomenon is called referred pain and indicates pain perceived in a part of the body other than the one where the tissue damage occurred. Sudden vertigo. The term vertigo indicates an illusory sensation of movement of one's body or of the space around one, when in reality one is completely still. Since myocardial infarction occurs when blood flow to part of the heart muscle is cut off, the whole body will begin to feel the effects of reduced blood flow. Poor oxygenation of the brain causes sudden dizziness or vertigo, symptoms that can precede a heart attack and represent the alarm bell of an imminent loss of consciousness or fainting. Dyspnea. In medical language, dyspnea indicates a difficulty in breathing in which there is a feeling of lack of air and therefore of suffocation. Dyspnea is also commonly known as shortness of breath, wheezing, or air hunger, and generally arises during more or less intense physical activity, particularly in subjects with a sedentary lifestyle. In other cases, however, it can be a symptom of heart and lung problems, including myocardial infarction. The difficulty in breathing derives from the reduction of the blood flow to the heart and the difficulty in the gas exchange that takes place in the pulmonary alveoli, in particular between the blood present in the capillaries and the air contained in the alveoli. Other symptoms. Other symptoms of myocardial infarction include cold sweats, cough, nausea, and vomiting. The occlusion of the coronary arteries causes the progressive death of cardiac cells and therefore the release from the damaged tissues of a series of metabolites, including lactic acid and pyruvic acid. The production of these biochemicals causes the onset of nausea and stimulates the so-called vomiting center. The latter is located in the area postrema, a structure located in the brainstem, and deals with the activation and regulation of the vomiting stimulus. Remember that the symptoms that precede a heart attack vary greatly from person to person and can easily be confused with other pathologies. Learning to recognize the warning signs of a heart attack can give you a valuable advantage in alerting emergency services immediately. Timely medical intervention increases the chances of survival, as for every 10 minutes of delay, there is a 3% increase in mortality. Anyone who is faced with a person who manifests one or more of these symptoms described should immediately call 911, and while awaiting the arrival of help, carry out the maneuvers that the healthcare provider communicates over the phone.